into exactly the families that he refers to.
Question number 10, the Honourable Annette King.
Thank you, Mr Speaker. My questions to the Minister of Health. What recent reports has he received on the affordability of health care for New Zealanders?
Honourable Tony Rao.
Mr Speaker, I've received dozens of recent reports on healthcare, nearly all of which have an affordability element. One specific report I've received on affordability is that despite tight times, this government has increased funding by an average $500 million a year over its 5 years in Vote Health. DHBs, of course, are often moving around resources to meet the changing needs of New Zealanders.
Question, Mr.
Supplementary
Speaker.
Question, Honourable Annette King.
Does he agree with the conclusions in the Child Poverty Monitor that of concern is the number of children whose visit to a GP was postponed because of costs? And is this why there has been 40,000 hospital admissions each year under his watch of children aged between 0 and 14 years with diseases of poverty, including bronchiolitis, acute upper respiratory infection, pneumonia and skin infections?
Honourable Tony Rao.
Mr Speaker, on the issue of access to general practice, this government's invested, I think, about $30 million in bringing free after-hours visits to general practice up and down the country. Currently, about 96% of New Zealanders under 6 can now go to the doctor free during the day and after hours. And this is making a considerable impact to the ambulatory sensitive hospitalisations of children in that age group.
Supplementary question,
Supplementary
Mr. Speaker.
question.
Well, in light of that answer, is he aware that the Child Poverty Monitor now backs up the findings of the recent New Zealand Health Survey, which showed that over 180,000 children have an unmet need to primary health care, of which 43,800 couldn't visit their GP because of cost? If so, will he increase the funding provided for primary health care for the poorest, sickest children from the miserable $5.60 per child per year he announced in this year's budget?
Honourable Tony Rao.
Well, Mr Speaker, the government has increased the subsidies to GPs every year. The government has also provided some extra funding for very low-cost access, and will also be making a further announcement on additional resources provided to those practices. And what I can say is, despite being Minister of Health for 6 years, that member never delivered free after-hours.
Order.
Point of order. The Minister was straying into material he's not responsible for, Mr Speaker.
That's right.
And attacking another member.
Order. I think the member makes a reasonable point. The answer is now concluded. Further supplementary?
Thank you.
Supplementary, Dr Paul Hutchison.
Mr Speaker, to the Minister of Health, what recent reports has he seen that call for more elective surgery to be a priority?
Honourable Tony Rao.
Well, Mr Speaker, I've seen a couple of very, very interesting reports. One is with the opposition health spokesman opposite, calling for more money for older people for elective surgery to be the priority for government spending, and then 2 days later that same Labor spokesperson was beating another drum, saying that actually the priority should be on children's health spending.
Single-minded.
Supplementary question,
Mr Speaker.
Honourable Annette.
Does he agree with the statement by the Prime Minister about the cost of going to a doctor? Quote, "Oh, well, look, in the end, it's called a market. And if they decide to charge a lot more, then probably someone will go down the road," end of quote. And does that attitude account for the fact that tens of thousands of children miss out on vital primary health care because they can't go down the road?
Honourable Tony Ryle.
Mr Speaker, the information I have is that we've increased our funding for primary health care by well over $160 million over a 5-year period, which has gone into additional services and increased subsidies for general practice and other involvements in primary care. And of course, I always agree with the Prime Minister. This is a Prime Minister who's been strongly supportive of the average $500 million a year extra that has gone into vote health under his stewardship.
Question, Mr Speaker.
Supplementary question, Honourable Annette King.
Does he agree with the Child Poverty Monitor findings that there is marked ethnic inequalities for all the health indicators reviewed? If so, why has he allowed many DHBs to actually reduce the funding provided to Maori primary health care NGO providers over the past 2 and 3 years at a time when poverty and sickness is so high?
Honourable Tony Ryle.
Mr Speaker, the fact is that there are many indicators which will show that the government is making progress with respect to reducing disparities. I look at one in particular, and that is immunisation, where, as I previously told the House, in most of our DHBs, in fact over half of them, the Maori immunisation rate is now higher than the Pākehā immunisation rate.
Point of order, the Honourable Annette King.
Mr Speaker, my question was whether...
I invite the member to repeat the
Does
question.
he agree with the Child Poverty Monitor findings that there is marked ethnic inequalities for all health indicators reviewed? If so, why has he allowed many DHBs to actually reduce funding to primary healthcare NGO providers, Maori providers, over the past 2 and 3 years at a time when poverty and sickness is so high?
Honourable Tony Ryle.
Mr Speaker, no, because, as I pointed out, the immunisation target, which is not one that the opponents of the government like to talk about, actually shows that despite 9 years of rhetoric and huge budget increases, Labor was never able to close the gap in 2-year-old immunisation, and this government has.
Exactly.
Question number 11, Claudette Hoiti.